I'm your insulin pump, Peter the Pump.
What's insulin?
Insulin helps your body feed your cells, but people with diabetes have a problem with insulin, so the cells don't get the glucose they need. You, my friend, needs insulin, and I can help.
Why do I need it?
Without insulin, you could have eaten a huge slice of pizza, but your cells won't be fed. That pizza is turned into glucose. It goes into your bloodstream. The cells can't use the glucose unless there is insulin to help them eat. You see, insulin acts like a key to open the door to the cells and let the food in.
In your type of diabetes, type 2, your body makes insulin, but your cells can't use it very well, so the glucose still can't get in. And your cells can't eat and get energy.
Before diabetes, your pancreas made all your insulin. Like a smoke detector, your body sensed when there was more glucose in the bloodstream. It sent out an alarm. Time for more insulin, time for more insulin.
Are there different kinds of insulin?
Insulin that's not made in your body comes in several types. Each type works at a different pace. Different type of insulin are like different type of Olympic runners. Some are like sprinters, others are like marathon runners, and then there are ones in between. Rapid-acting insulin called Lispro or Humalog is the fastest insulin. It starts to work within 15 minutes. It's used up in 4 or 5 hours, and you take it right before meals.
Short-acting, also called regular insulin, is also used around mealtime. It takes longer to work than rapid-acting insulin. It's taken about 30 to 45 minutes before eating. It can keep working for up to 6 hours. Rapid-acting and short-acting are both clear-colored.
Two types of intermediate-acting insulin are NPH and Lent. They're mixed with the substance that makes the body absorb the insulin more slowly, which make them cloudy. NPH begins to work about 2 to 4 hours after taking. It works hardest 4 to 10 hours after injection. It keeps working for 10 to 16 hours. Lent lasts even longer. It stays in the body from 12 to 18 hours. Long-acting insulin or Ultralent starts to work in 6 to 10 hours. It can stay in the body for 20 hours or more. It's taken in the morning or before bed.
If my body isn't making enough insulin, how do I get it?
When a pancreas works like it should, it dribbles out small amounts of insulin all the time. At mealtime, it gives a big squirt to turn the food into energy. This is pretty much how I work. The insulin stored in me travels to your body through a thin plastic tube that's new. Here, I deliver rapid or short-acting insulin 24 hours a day.
How much insulin do I take?
For now, you will take 0.1 unit every 6 hours. But as you grow and get more active, it will change.
What happens if I take too much insulin?
Too much insulin can cause low blood glucose, also called hypoglycemia. Insulin keeps working until it's gone. Even if the blood glucose is low, mild or moderate low blood glucose are pretty common for people who take insulin, but it can get dangerously low pretty quickly. People with severe low blood glucose can affect their brain. It's important for you and your parents to observe what symptoms are unique to you.
Why is it important? What are the symptoms?
Here are some of the symptoms. It's important so you can recognize it and treat it before it becomes serious.
What do I do if it happens to me?
It's best to prevent hypoglycemia by checking your blood glucose regularly. But if you notice symptoms, treat it right away by eating or drinking something within 10 to 15 grams of carbohydrates, and then check your blood glucose after 15 minutes. Once your blood glucose begins returning to normal, eat a snack with the carbohydrates and protein. If your blood glucose stays too low, go to the doctor.
What happens if I don't take enough insulin?
Too little insulin can cause high blood glucose or hyperglycemia. Everyone has it once in a while. It's a problem when you have high blood glucose a lot, but when the level is too high. Some symptoms are being thirsty, fatigue, weakness, going to the bathroom a lot, and blurry vision. It's best to prevent hyperglycemia by practicing good diabetes management. Learn to detect and treat it early before it gets worse. You can lower your blood glucose by exercising.
Are insulin pumps the best way to get insulin?
You may decide to use other insulin delivery methods at some point, like some of these, and scientists are working on new methods like patches, inhalers, and pills.
Awesome! So all I have to do is take my insulin and my diabetes will be better?
There isn't a cure for diabetes. People with diabetes have to control it, and taking insulin is only part of the way. What you eat and staying active are just as important. It's really important for someone with diabetes to eat properly. Only eat when you're hungry. Eat just a little bit less every time you eat. Eat more slowly. Eat less fat and glucose. Exercising is just as important too. The more calories you burn, the better your body uses insulin. Make sure you do something active every day. You may even reach a point one day where you don't need me and you can control your diabetes with proper nutrition, exercise, and blood glucose monitoring.
Thanks, Peter.